Hello, my name is Carlos Bloom, and today we're going to talk about the actual classifications of the bladder. First, as a definition, we have that the calcification is a deposition of calcium phosphates or other calcific salts at sites which not normally have become mineralized. Abnormal accumulation can occur in areas of tissue damage, causing the dystrophic calcification, or hyperkalemic or hyperparathyroid states. Now, really to further understand this topic.
Hello viewers, welcome to Pathology Discussion Forum, and today in Med School Microblog 6 I will talk about dystrophic calcification. But before going into details, let me explain what is pathological calcification. Pathological calcification is calcification that is occurring in any site of our body other than osteoid or enamel. The type of calcification that is occurring in osteoid or enamel is known as physiological calcification. It is of two types. The pathological calcification can be divided into dystrophic calcification and metastatic calcification. Dystrophic calcification is called when it is occurring in dead or degenerated tissues. Now let's have a look at the examples of dystrophic calcification. Dystrophic calcification commonly occurs in focus of caseous necrosis. Caseous necrosis commonly involve lung, bone, or any internal organ. At the center of this caseous necrosis, there may be calcification, and that is one type of dystrophic calcification. The next example, that is liquefactive necrosis. The center of any abscess or chronic inflammation that may get calcified, leading to dystrophic calcification. Another example is fat necrosis, that is commonly occur in case of acute pancreatitis or any traumatic necrosis in breast. Another example is gamma antibody, that is deposition of iron mixed with calcium, magnesium and some other minerals in spleen. That is known as gamma antibody. It is one example of dystrophic calcification. Dystrophic calcification also can occur in center of infarct in case of thrombus or any hematoma that is adjacent to any bone. Now, the dead parasites in our body that may get calcified, leading to dystrophic calcification. In case of breast cancer, the center of this lesion may get calcified, and that is another example of dystrophic calcification. Now, in case of congenital toxoplasmosis, dystrophic calcification also can occur. Now let's have a look at the degenerative tissues showing dystrophic calcification. The most common example, that is old scar. The center of old scar may get calcified. Also, another entity known as Monkeberg's medial sclerosis. There is calcification in the tunica media of blood vessels. Also, the center of fibroid may get calcified. Another beautiful example of dystrophic calcification is Samoa body. It is commonly seen in thyroid carcinoma and in some other papillary lesions in various places of our body. Old cyst may get calcified, and there may be calcification in various sites of our body without any known primary reason, that is known as calcinosis cutis. Now let's talk about the mechanism of dystrophic calcification. Now, in dead or degenerated tissue, there is denaturation of the protein, and due to denaturation of this protein component, they usually bind with the phosphates, and this phosphate attracts the calcium ion within our body, leading to formation of calcium phosphate, and that calcium phosphate that is deposited in our body in the form of dystrophic calcification. Okay, that's it for now. In our next vlog, I will talk about some other topics, and if you are new to our channel,
Now, to talk about the applications in medicine, we need to understand that the eggshell calcification of the bladder are caused by different type of pathologic cases. First, we have the cystitis post-radiation therapy, chemotherapy, or chronic infection. The radiation itself may cause the calcification, eosinophilic cystitis, schistosomiasis, and tuberculosis. Schistosomiasis is the one we're going to focus on, as it is the infection of the schistoma, which is a parasite, and the eggs lead to the calcification. This is the most common reason for the eggshell calcification of the bladder. Now, talking about the pros and cons, we have the eggshell calcification of the bladder is the most characteristic of the schistoma parasite. Knowing this, we know that calcification appears in advanced cases only. And there are a number of diagnostic techniques, which the one that have the better results is using a nylon or a paper polycarbonate filters to identify the eggs in the urine. Proper treatment may reduce the effects of this parasite on the body of the patient. Now, to talk about the cons, the children with schistosoma amoebium almost always have microscopic blood in their urine. Therefore, it may be harder for parents to notice that there's something wrong with their children. There also may be cause anemia, stunting, or reduces ability of learning. Now, to understand what this may affect Ecuador is that Schistoma mansoni, which is a species of this parasite, is endemic to Africa, the Middle East, the Caribbean, Brazil, Venezuela, and Suriname. As we know, recently there have been a high number of immigrants from Venezuela. So if some of them may be infected by this parasite, which is endemic to their country, that may be causes infections on people from Ecuador. In conclusion, we know that intracystic calcification is usually thin and peripheral, and it often described as having an eggshell appearance. In these cases, the most common reason is an infection of schistosoma parasite. There must be the correct test to have an accurate diagnosis, therefore discarding other possible causes such as the cystitis post-radiation therapy, chemotherapy, chronic infection, eosinophilic cystitis, or tuberculosis. By having this differential diagnosis, we have a better chance of treating the patient and therefore giving them a solution to their state. Thank you.